Next up is Tracy Parris-Benjamin, who's Senior Director, Health Equity and Community Equity for Horizon Blue Cross Blue Shield of New Jersey, and she'll be speaking to us today about mental health equity. Tracy, the floor is all yours.
Thank you so much, and good morning to everyone. It's nice to see familiar faces. And as you think about the topic discussion, I think one of the most important things is community and connection. As the Senior Director of Health Equity and Community Health, one of my primary roles is really focused on advancing and having discussions about things that are sometimes uncomfortable. And in order for us to receive or get to quality of care, it is imperative that we begin to have some of those discussions. So I think one of the most important things is to level set and to start with kind of defining what is equity. Depending on what, environment that you're in, it may mean different things. And I would say to any organization or leader that's on the phone, it is to define what equity is to this particular organization based on the goals and the mission of your organization. But just to level set for this particular conversation, very simply, equity is really defined as having a fair opportunity for one to attain their highest level of health. And why is that important? It's important because when you think about striving for health, we know that there are structural barriers that dictate how individuals use the healthcare system. So I'll speak primarily from my work at Horizon Blue Cross Blue Shield, but kind of take you through a little bit of a journey. My background is that of a social worker. And what I will say is that I've worked in many different sectors. I've worked in the nonprofit setting, I've worked in hospitals, and now for payers. And one of the things that remains really constant throughout my career is very often the voice of the member, patient, client is often not at the seat of the table. When you talk about leadership and mobilizing change, it is important to have all of the experts. You need clinicians, you need, your finance folks, but you really need the voice of the member, patient, client to really truly understand the needs of the community. And that helps to support more equitable outcomes. So you have to start, I will say first, with the recognition that structural racism, implicit bias, all of these things permeate the healthcare system and really impacts the disproportionate disparities that we see among marginalized communities, primarily individuals, people of color. You have to call that out. It is so important. The need for calling that out is to not make individuals feel bad or to cast blame. It is just like the diagnosis of any condition. When you go to the doctor wants to know, how long have you had this? What are the symptoms? You have to think about developing your programs around wellness in the same way, understanding the needs of your employees, understanding the needs of your patients, clients, members. And I always refer to them in those three sectors from the perspective of where you sit. The other thing I would say is really important is to understand the impact that traumatic experiences have on individuals. So not only the presenting problem. So, if you go to the doctor, if you go to your therapist, you present a particular problem. Usually that's impacting you today. What we find is traumatic experiences, where they're direct or indirect, really kind of dictate how individuals see the world. So if you don't call out things that have been impacting individuals, let's say, knowing that the color of one's skin can dictate whether or not they come home because they may have rang the wrong bell, whether or not, someone is just at the wrong place at the wrong time, knowing that those things can impact the health, the wellness, and how someone interacts with the healthcare system is really important. It's important for an employer to know. These are the things that your employees are showing up with that you don't always see. I'll give one example. I think it's really important for us personally, and when I say us, we collectively, that we recognize that mental health is something that impacts all of us. I think a lot of times, at least I can speak for Horizon, or even working in hospitals, we would say, sometimes these patients, these clients. And when you put individuals into a bucket, what you do is you create this separation as if you are not that patient, as if you are not that client. And it is really imperative, really for leaders. A lot of the work that I do is speaking to leaders about leading with empathy and understanding that we are member patients, clients. At any point in our lives, we can be impacted, whether that's by illness, caregiver burden. And I don't know about everybody else, but this world of anxiety is just a constant. This world of depression is a constant because no one taught us how to live through a pandemic, and we're still learning as we go along. So those traumatic effects, whether it's from childhood, whether it's something you're currently experiencing, as well as coupled with the pandemic, continues to permeate society. So in order for you to reach equitable outcomes, you have to address those things. I think it's really important for employers and leaders to define that mental health is something that is normal. It is normal in the sense of needing to continue to fill your cup, needing to ask for help, needing to build communities. And I think the important piece of this is the call out that as a leader, if you are experiencing something like depression, like anxiety, it is important to call it out. Obviously, you have to feel comfortable to do so. But what those things allow is to normalize these things that we experience that sometimes I call stuff, right? It's stuff that we experience. It's not unique. And what you begin to do is you form bonds where people feel comfortable and begin to identify. I know as an African-American Black woman, there is this idea very often that, there's a strong Black woman that wears this invisible cape, right? And that makes it very difficult for a lot of communities to be able, or persons like myself, to be able to showcase vulnerability. And I think that that is really, really important because this expectation that you have to be this or you have to be that, we've seen it countless times that individuals that we see, whether it's in the media or leaders or, people who are extraordinary in their field, suffering with depression, suffering with anxiety. So I think that's a really important concept in normalizing and reaching health equity. So some folks may say, well, where do you start? I think you start with recognizing the fact that it is important to lead with empathy, the understanding that you would want your loved one to be treated in various venues, whether it's school, church, work, to be treated with respect, to be treated with dignity, and to recognize that those things are so important in achieving equity. The other piece that I would say is really important is investing, doing self-assessments of yourself, asking yourself questions as it relates to your own implicit biases or attitudes towards mental health. And often we don't always know we have those blind spots. It's really important to recognize that if you do, how do you begin to address them? And how does that not impact your day-to-day interactions? How does that not impact, decisions you make on who you choose for positions because potentially they may have a mental health condition or they may be experiencing something. It's all of those things that's really important, I think, for employers, I think for leaders. The other I would say is insights into your data. So any wellness program, I think it's important that it's not a blanket program. It's one that can be customized in some ways to the needs of the individuals, to the needs of the community. So that is a focus on desegregating data, looking at data, whether it's based on race, whether it's based on ethnicity, disability, LGBTQ plus communities. So you can then develop and customize your equitable programs to really support the needs of those individuals. If you have one particular intervention, that doesn't mean that intervention is going to be applicable to all. And then you want to look at the data and see, are there variations in the outcomes based on race, ethnicity, and those other categories? The other piece that I would love to just be able to talk a little bit about is the fact that there are social barriers, social drivers that dictate a lot of how individuals either have access to getting the mental health services that they need, or just interacting, with colleagues, right? Sometimes, I've seen cases where someone may not get a promotion because they may be dealing or have neurodiversity and it's never been shared. So it's important for employers and leaders to customize affinity programs or wellness programs that support and enable individuals, that allow them to feel comfortable in that environment and recognize that you don't have any, implicit bias around individuals that may be experiencing those things that limit the ability for them to be promoted or to move into spaces of leadership or to get a stretch assignment. We've seen this happen all too often. I know I've seen it in my career. And once you recognize those things, you have a heightened awareness and there's more sensitivity around that. The last thing I will add is really about reimagining health. Reimagining health from a standpoint of health does not just happen within the four walls of the hospital or the doctor's office or the reliance only on mental health professionals. Reimagining health allows us to build a resilient community. And that starts with how the workplace engages with various and different individuals, faith-based organizations, schools. I would implore everyone that's on this call today, all of the different supporters, of the organization today that we're really focused in, has brought us together to bring this important topic, to really think critically about how you're addressing equity in your day-to-day practices, because I think at the end of the day, the outcomes that you're striving for in any industry, you won't see the fruits of your labor if you don't start to, number one, as I went back before, call out structural racism, call out disparities, look for opportunities to really engage and get feedback, have leadership promote and focus on addressing their own issues to normalize and support when possible. And lastly, it is going back to reimagining health. So I thank you today for this presentation. And I really just want to hope and engage everyone that you're filling your cup, whatever that is, finding connections in community and really leading with empathy. Thank you.
Thank you so much, Tracy. That was very inspiring. And you gave us some really incredible, helpful hints and thoughts about how we can be part of the solution in this space. And that's what we're all about, right? We're here to get together to share best practices, to give ideas, and then to take action. And I think you've set us up to take some action as individuals, and we thank you for that. So thanks so much for joining us, Tracy.